Afternoon, and thank you for joining us for today's COVID-19 media briefing. It's a Q&A all about vaccine. This briefing is being aired live on YouTube. Joining us today are DHS Deputy Secretary Julie Willems-Van Dijk and Dr. Stephanie Schauer, Immunization Program Manager in the Division of Public Health. And we will begin today's briefing with remarks from Deputy Secretary Julie Willems-Van Dijk.
Well, good afternoon, and thank you for being here. As Elizabeth said, I'm joined today by Dr. Stephanie Schauer, who co-leads the vaccine response as part of the COVID-19 response team. And we're looking forward to answering your questions about COVID-19 vaccine. As we've talked about, there are a lot of moving parts to this process, and those parts are moving very fast right now. This is very exciting because it means we are making progress towards our goal of distributing vaccine to you quickly, safely, and equitably. But as I said last week, distributing COVID-19 vaccine is the most significant public health undertaking of our lifetimes. And we are adapting this process on a daily basis, sometimes multiple times a day, to make sure we get the job done and get it done well. And we will, but it's going to take time. In the coming months, starting as soon as today, we will begin providing vaccine to Wisconsinites, starting with our Phase 1A healthcare workers and residents of long-term care facilities. As vaccine supply increases, we will continue to expand recommendations and educate the public on those recommendations. Last week, we discussed a number of steps that had to happen before vaccine could be administered, and a number of those steps have happened in the past few days. It's been a very busy weekend. On Thursday, the FDA's Vaccines and Related Biological Products Advisory Committee met and voted to recommend approval of the Pfizer-BioNTech vaccine for people 16 years of age and older. On Friday, the FDA issued an emergency use authorization for this vaccine. On Saturday, the Advisory Committee on Immunization Practice voted to recommend the vaccine and issue clinical guidelines for administration. On Sunday, the CDC director signed ACIP's recommendation, and it was published in Morbidity and Mortality Weekly Report, or the MMWR. Today, tomorrow, and Wednesday, shipments of Pfizer vaccine are arriving here in Wisconsin. And we also can share that as of today, Wisconsin has officially activated the program for COVID-19 distribution to long-term care facilities, beginning with skilled nursing facilities. This is a partnership between the CDC and national pharmacy chains that will begin later in December, pending the EUA of the Moderna vaccine. As vaccine arrives, each of our providers will complete a Vaccinator readiness checklist to confirm their preparations for safely vaccinating. This checklist reviews items such as completing training on safe handling of vaccine and clinical protocols, assuring their medical orders are aligned with the EUA, and having patient information materials ready to distribute. Once they complete those safety protocols, have vaccine, and schedule their staff, they will be ready to vaccinate. Again, this is a complex process and we are ready for it, but it will take time to vaccinate all of those in Phase 1A and beyond. While we undertake this work, the virus will still be here and we will still be in danger of spreading it if we do not take preventive steps. This is where we need your help. To make it easier for the vaccine to do its job, we need to do our part to stop the spread now. Stay home, do not interact with people you do not live with, wash your hands frequently. When you do go out for the essentials, wear a mask and practice physical distancing. And please, if you have been exposed to COVID-19 or are experiencing symptoms, even mild ones, get tested. Call your healthcare provider or find a community testing site. A link to those sites, their addresses and hours of operation is on our website. As we move forward in the vaccination process, we will continue to share updates with you regularly through briefings like these, and we will also keep our COVID-19 vaccine webpage updated. You can find our most current information by going to dhs.wisconsin.gov/COVID-19 and clicking on vaccine. I'll now hand it back to Elizabeth so we can answer your questions. Thank you.
Thank you, and we will now take reporter questions. A reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and unmute. And we begin with Scott Bauer of the Associated Press.
Hi, thanks for doing this call. Can either of you say if anyone has actually been vaccinated yet in the state? And if so, where? And if not, where do you anticipate those first vaccinations happening?
To our knowledge, no one has been vaccinated yet in the state.
All right, thank you for that. And the next question to Stephanie Hoff, WIS Politics.
Hi, and thanks for taking my call today. So my question is, you know, if my grandparents were to get vaccinated, does that mean even though I'm not vaccinated, we can spend time together? Or if my friend who's a frontline worker gets vaccinated, does that mean we can go watch the Packer game at a bar together?
Stephanie, would you like to answer that?
Sure. I think it's important to remember that vaccination has been studied and is approved for, the endpoint that they used was symptomatic COVID infection and being PCR positive. We don't know about what the vaccine will do in terms of protection of infection or the ability to transmit. So we still need, even if you're vaccinated, to take all of the proper precautions that Julie has spoken about. Vaccine is another layer in the fight against COVID, but it doesn't mean that we can abandon everything else that we have been doing thus far. It's another layer, and we need to continue doing all of those things. I think I would also add in is that it's important to remember this is a 2-dose series. So you need both doses to ensure that you have appropriate protection, and 1 dose is not what they are looking at when they talk about the 95% efficacy.
Thank you for that. The next question to Mark Johnson at the Milwaukee Journal-Sentinel. Mark Johnson. All right, moving on to Jessica Van Egeren, Up North News. Jessica.
Hello.
Hi, this is
Mark.
actually Christina Leffering from Up North News. So how do you guys have a plan in place for how to reach out to minority communities which have been hit harder by the virus, but also may lack access to healthcare infrastructure?
Yeah, that's a great question, Jessica. We are in the midst of planning a number of ways to reach out to minority communities and other communities who have been hard hit by this vaccine, and plan to work with community leaders and others who are trusted messengers in those communities to assist them with understanding the vaccine, how it has been developed, how it has been tested, and how it can help protect each person. Again, I want to reemphasize, it will be a little bit before we'll be going to give vaccine in a widespread way to those communities across the state, because this first group 1A, that we are vaccinating now, will be focused on healthcare workers and people in long-term care facilities. Now, again, that we understand that there are people from minority communities who are part of those groups as well, too. So we'll be doing that kind of outreach, but outreach to communities or neighborhoods will be a little bit farther down the road. And I think the good news is we'll also have the experience of having vaccinated many healthcare workers and long-term care residents, so people will be able to see how this has gone through these first phases of vaccination to help them inform their decisions as we move forward to broader populations across Wisconsin.
Thank you for that. And I think Mark Johnson of the Milwaukee Journal-Sentinel is on with us. Mark Johnson. A reminder, *6 will mute and unmute your phone. Milwaukee Journal-Sentinel. All right, we'll try to get back to Mark, and we'll go now to Victor Jacobo. Oh, Mark, do we have you, Mark?
Hello, can you hear me?
Yes, we can hear you.
Okay. I just wondered why DHS hasn't yet disclosed the list of distribution hubs. Why has that not been given out?
Yeah, and Mark, I just want to say on behalf of all of us, we've been thinking of you at the Journal-Sentinel with the loss of Meg Jones, who was such a great reporter and an asset to our state, and know your hearts are heavy today. And
they are.
Yes, I'm sure. So we have not, going to your question, we have not disclosed the sites where we are delivering this vaccine and storing it for security reasons. You know, this is precious vaccine. It is, we do not want to create any security risks. We've been in contact with the Department of Homeland Security, and that is their counsel to us as well, is the less we talk about where the vaccine is, the more secure it will be. And so as we distribute vaccine and we administer vaccine, our department will be providing lots of information about who has received the vaccine across the state. But at this point in time, based on Security Council, we are not disclosing those locations.
Thank you for that. The next question, Victor Jacobo, CBS 58 in Milwaukee.
Hi, it's Mark McPherson. I'm filling in for Victor today. I think when people hear that there's going to be a rollout starting with phase 1 healthcare workers and long-term people in long-term care facilities, they're wondering when it might reach them. And I know you said it might take a while, but do you have a ballpark? Is it March, April, May? How long? Are we talking weeks or months? And when it is available, how are people going to be able to get it? Is that through their doctor? Or is there going to be some sort of something set up where they can be tested, or excuse me, vaccinated?
I do the same thing. I'm mixing up tests and vaccines all the time. So it is very difficult to tell you exactly when. I think I would couch it in terms of months before we're doing vaccination more widespread. It will certainly be more than weeks. But there's a lot of factors that will inform how quickly this goes. Some are in our control, some are out of our control. And so, again, we're just asking for people's patience. We will get there, but it will take time. When it is time for us to open up vaccination more widely, there'll be a number of different ways that people can secure a vaccine. Certainly through their doctor's office. You know, when I do the comparison to testing, I want everyone to know well over half of the tests for COVID-19 have been done in the healthcare system. And we would anticipate similarly, well over half of the vaccines will likely be given in the healthcare system as well. But also think about places where you also get your flu shot. And those are the other types of places you may be receiving a COVID-19 vaccine as well. Maybe at your local pharmacy, maybe at a community-based clinic. We are preparing to run a number of mass vaccination community-based clinics throughout the state, because we know the volume of people requiring vaccine is going to be too big for our healthcare system to handle. And so there'll be, just like there's community testing sites, community vaccination sites. And so all those different avenues will provide many options for people once that day arrives.
Wonderful, thank you. We go now to Brittany Schmidt, WBAY in Green Bay.
Hi, I would like to ask a little bit about how you're going to monitor the vaccine rollout. I know in a press release you guys kind of sent earlier, it shows like sorry, I'm just pulling it up here. VSafe, after vaccination health checker. Can you walk me through what that looks like? And after somebody gets that vaccine, they're going to get text messages about when they should go back, et cetera.
Great. Dr. Schauer, would you like to talk about that?
Sure. So I think it's important to remember that every dose of COVID-19 vaccine that's administered is going to be reported to the Wisconsin Immunization Registry. So that allows the state and locals to go ahead and have a handle on who's getting vaccinated where and to identify where there's gaps and needing to be filled in. The VSafe program is actually something that vaccinees will be reporting. It's a program that they can opt into, and it will, as you said, through their smartphone on a daily basis for the first 14 days, text them or ask them about symptoms that they've had. So that's on the safety monitoring side. While we're talking about safety, I think it's important to note that there's a number of different programs in place to monitor vaccine safety. In addition to the VSafe program, there's also the Vaccine Adverse Event Reporting System. This is a system that has been in place and is used already for vaccines, and COVID-19 will be added to that. And that's where if anyone has symptoms post-vaccination, that they can go ahead and report, or their provider can go ahead and report that information, and that is looked at on an ongoing basis, and further investigation is warranted if something unusual pops up. There's a number of other programs regarding vaccine safety done by the FDA and the CDC. But the VSafe one is just the newest one into that whole suite.
Thank you for that. Next question to Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. I was wondering, could you talk a little bit more about the steps for vaccinating those in long-term care facilities? I think you had mentioned that that you activated something today regarding that. But how long would we expect to see before folks are vaccinated? Thank you.
Great, Sean. So this is what we activated today was the National Pharmacy Program for Long-Term Care Vaccination. This is a partnership between the CDC and national pharmacy chains, including Walgreens and CVS, to vaccinate people who live in long-term care facilities. And so by activating today, we have requested that the program start in the minimum interval that is between activation and program start, and that is 2 weeks. And so it is our hope that we will be starting to see vaccination in our skilled nursing facilities around the end of the month. And so how this program works is we take a portion of, we take our vaccine that is allocated to Wisconsin and reallocate it to this program to provide the vaccines to the pharmacy chains to then go into the facilities and vaccinate both residents and staff who have opted to receive the COVID-19 vaccine. So of course they'll go in initially, and then they will come back 3 weeks later to provide the second dose, and also to pick up any residents or staff that may have been missed or who opted out but changed their mind the first time they were there. And then they'll come back 3 weeks later and finish the second dose on any of those who received it in their second visit. So we'll be in conversation now that we've activated the program with the pharmacy chains to gain more information about how many skilled nursing facilities they'll be able to vaccinate each week and how quickly this will be accomplished. But we're really hopeful that this means the majority of residents in our skilled nursing facilities will be vaccinated by the end of January. The second part of the program then is we will activate a second part that will provide the same type of services for people living in assisted living facilities. So this would be facilities like community-based residential facilities or CBRFs, adult family homes, and a variety of other agencies that are generally lower acuity of care than our skilled nursing facilities. We have not activated that portion of the program yet, and that is, we will be soon, but we need to see where our allocation of vaccine is, because you have to have enough vaccine in the bank to support the program once you decide to activate. Dr. Schauer, anything you would add?
No, I think you got it. And I think one of the benefits of the ACIP moving the long-term care facility residents up from 1B, where they originally were, up into 1A, is that now we, as Julie said, we can ensure that the healthcare workers in those facilities are vaccinated at the same time as the residents.
All right, thank you both for that. We go now to Francisco Almenara, WKOW.
Hi, can you guys hear me okay?
Yes, we can hear you.
Hi, yes. So we were just kind of wondering, what is the rate of delivery of vaccine in Wisconsin? How many doses are we expected to get per week, per month?
Dr. Schauer, do you want to take that?
Sure. So our first allocation of Pfizer vaccine is 49,725. We do have a projection for one more week after that, and for Moderna, we have a projection of 101,000 doses, but that's all the information that we have. And so, as Julie said, the rollout of the program and how long it will take to get through the different phases really depends on the amount of vaccine. And right now, we are continuing to work with the planning numbers that we have, but we don't have very far. So each week we will continue to get more information.
All right, thank you. And the next question to Derica Williams, Fox 6 in Milwaukee.
Hi, good afternoon. You had mentioned it's obviously going to take months for the average person to get it. Is that going to be free? And also, will employers kind of require people to get the vaccine, or even the state when it comes to the public or private sector?
Yeah, I can assure you the state has no intention of mandating the vaccine. What private employers do, they may, will be up to each employer as to the conversations they want to have with their employees. The vaccine is, as I like to say, it's prepaid with your tax dollars. The federal government has purchased this vaccine for the residents of the United States, and so the vaccine itself will not be a charge to anyone receiving it. Your healthcare provider may charge an administration fee that would be totally acceptable, and that fee can be charged to your health insurance for those who have health insurance. For those who do not have health insurance, at our community-based mass vaccination clinics across the state, we will not be charging an administration fee for anyone who doesn't have health insurance. We will also be billing your insurance companies to pay for the administration fee. So everyone should be able to get the vaccine with no money out of their pocket. The most important thing is that we make this readily available to as many people as possible, because that is also what starts to shift that situation that Dr. Schauer answered for earlier, is once the majority of us have vaccine, we move, or a high percentage of us move into coverage with vaccine. We move into a situation with herd immunity that will definitely start to reduce and hopefully eliminate the spread of COVID-19 in our community. So we want to make this as easy as possible for the most people to be vaccinated.
Thank you. And now to Casey Nelson, WTAQ in Green Bay.
Hi, Rob Sussman in for Casey Nelson today. My question is there any sort of priority based on region as to kind of who gets these vaccines first? I know that certain parts of the state have been hit by this at higher rates than others, so I was wondering if there's any sort of, if that's playing into the distribution strategy whatsoever. Thank you.
Yeah, that's a great question. And as we've mentioned our state disaster advisory medical committee is providing us with guidance around how we distribute vaccine across the state, and we await their recommendations later this week. This first supply of vaccine, we primarily used a population distribution method because it was coming before we had those recommendations. We didn't want to wait. We needed to get it going and make sure vaccine was available because everybody is awaiting that first dose. I think there are a number of considerations that I know the SDMAC is considering. One is the issue we've discussed earlier about populations that have been disproportionately affected, whether that be by race or, as you mentioned, Ron, by geography. And so that will factor in to the distribution proposal that I believe that they will propose to us. Another thing I just wanted to mention in regard to that, Dr. Schauer mentioned the Moderna vaccine. Right now, we only have authorization to use the Pfizer vaccine. The Moderna vaccine will be reviewed by the FDA later this week. But once it is approved, assuming it receives a similar outcome as Pfizer, it also greatly enhances our ability to get to more rural areas of the state, because the storage and handling of the Moderna vaccine is much simpler than the Pfizer vaccine. It does not need to be held at these extreme sub-zero temperatures. It can be distributed and held in any kind of a normal immunization refrigeration system, and it can be shipped directly to the vaccinator. And so that second type of vaccine will make it a little bit easier in terms of distribution, and particularly to rural areas of the state that might be a fair distance from one of our hub sites with the sub-zero refrigeration system.
Thank you. And we go now to Bram Sable-Smith, Wisconsin Watch.
Hey, thanks for the call. So you talked a little bit about how we don't know about the effectiveness of the vaccine in guarding against transmission and how that should influence our behavior. So I want to ask about some other uncertainties. Can you tell us a little bit more about what we do and do not know about the vaccine safety for pregnant women, nursing mothers, and children, and what we're recommending here in Wisconsin for those groups of people?
Absolutely, and I'm going to turn to my colleague, Dr. Schauer, for that question.
Yeah, no, I think those are great questions. The data is not currently available to establish the safety when it comes to pregnant women. We do know that pregnant women are at increased risk of severe disease, including ICU admissions, mechanical ventilation, and possibly even death. And so studies are ongoing and more are planned. But the recommendations from ACIP say if a pregnant woman is part of a recommended group, such as a healthcare professional, that she may choose to be vaccinated, and that a discussion with her healthcare provider can help her make an informed decision. And so they do list a number of things that she should be thinking about that should inform that conversation. And that includes the level of community transmission, her personal risk for contracting the disease, the risk of the disease to her and her developing fetus, and then also taking into the efficacy of the vaccine, the side effects, and also recognizing the lack of data about the vaccine during pregnancy. So it really is a risk-benefit piece that a woman should be having with her doctor. Similarly with individuals who are immunocompromised, is that the safety and the efficacy of the vaccine in these groups is not yet known, and it should be a conversation that they have with their healthcare provider. They may still elect to receive the vaccine, but they do need to be counseled that they may have a potential for a reduced response based on their immunocompromising condition, and that they do need to continue to employ other guidance in order to protect themselves. I think the last group that you mentioned was breastfeeding and lactating women. mRNA vaccines are not considered live virus vaccines, and they're not thought to be a risk to breastfeeding infants. And if a woman is part of the group that's recommended to receive vaccine, such as a healthcare worker, she may choose to be vaccinated if she is currently breastfeeding or lactating.
And the other group was children.
Children, thank you. So the vaccine has not yet received an indication for children because there isn't sufficient data. This is an area that's recognized that more data is needed, and that is forthcoming. As you noted, the vaccine, the Pfizer vaccine, is licensed down to age 16. However, we have to keep in mind that this is layered on top of the phase 1A. We are currently in phase 1A, and so this allows 16 and 17-year-olds who may work at a hospital or a long-term care facility to receive vaccine. But it doesn't really call for don't anticipate seeing the widespread vaccination of individuals in this youngest age group. We do know that the manufacturers are looking at more information and data gathering for children younger than 16, and we expect to see that information coming in the next few months.
Thank you. And we go now to David Wahlberg, Wisconsin State Journal. David.
Yes, thank you. I'm going to try to sneak in a three-part question. First of all, how many doses has Wisconsin received as of today, to your knowledge? The almost 50,000 Pfizer doses anticipated this month, that will be for roughly 50,000 people, not 25,000 people, because that's just the first dose, and their second dose will come later, correct? And my last question is, adding up the 50,000 and the 101,000 from Moderna gives you 151,000. That is fewer than the total doses expected in Iowa and Minnesota, according to the New York Times at least. Why are we getting less than those states when we have more people?
All right. I don't know how many doses have been received today. I know 2 of our hubs were receiving doses today and the remaining on Tuesday and Wednesday. So by Wednesday, I can tell you we should have received 49,000 plus, but I don't know exactly how many were received today. Stephanie, I don't know if you have that information.
I don't.
Yeah. No. You are correct, David, that the nearly 50,000 doses of Pfizer vaccine represents 50,000 people or 49,000 plus people who can be vaccinated. This is how the federal government is distributing the vaccine, is first dose, and then they hold the second dose ready to deliver 3 weeks later. So it is 50,000 people. This is a very confusing thing as we talk about doses, and believe me, we have to clarify it every time we're having a conversation. Is this first dose with second following, or is this total doses? But it is enough for nearly 50,000 people. On the question of comparisons to other states, we are only reporting what we have had confirmed from the federal government. There have been other estimates about how much we might receive in subsequent weeks, and we have not reported those numbers publicly because we've seen them shift wildly. And when I read the New York Times article that I believe you're referencing and saw what different states were reporting, many of them are reporting those estimates of how many doses they think they would receive through the end of the month. And the article itself is very clear about not comparing from state to state. So as we've said, the vaccine is really being distributed on a federal level by population. And we are watching that for our own population. And as you know, the governor has also issued a letter asking for additional vaccine earlier for Wisconsin because of the high burden of disease that we've had. To date, we haven't seen any change in our allocation over that, but we'll be watching very carefully to be sure that Wisconsin receives adequate vaccine for our population.
Thank you. And we go now to Gabriela Primus, WLUK in Green Bay.
Hello. So do you know an estimate or how many healthcare workers need to be vaccinated in Wisconsin and how long it'll take?
Dr. Schauer?
Yeah, so the estimates are it's upward of 400,000 individuals. And so when you think about our initial allocation of 49,000, it is going to take some time. We don't really know, or I should say, we don't know how much vaccine we will be getting in subsequent weeks. And so it is hard to predict how long that comes through. There are factors, as Julie said, that are within our control, and there are factors that are not within our control. So how long it is going to take really depends.
Thank you for that. Let's go to Denise Lockwood, Racine County I.
Hi, my question is with regards to kind of that big, when do we get back to normal question, but really specifically understanding what criteria you would use to say allowing people to go visit their loved ones in a nursing home. Can you kind of give me a little bit more of your thinking around that?
Yeah, I think actually we've thought a lot about when to allow people to go visit their loved ones in nursing homes, because we recognize that the social isolation that people in long-term care facilities are bearing is definitely a burden and a detrimental health effect for them as well too. So I think it is as much about other things we're doing to control the disease and the effect it has on the rate and transmission of disease as it is actually on any number of vaccines or timing related to vaccine. So I think the things that we are looking at is we need to see reduced community spread in the community where your loved one is in a nursing home. And so the things that we know Wisconsinites can do are all of the preventive measures I mentioned earlier in the briefing around mask wearing, physical distancing, keeping your social circle small, washing your hands, and all of the things that we can do right now, even without vaccine, to reduce disease transmission. We are looking, when disease numbers go down, then that we would be able to allow limited numbers of visits to long-term care facilities from limited numbers of family members using appropriate personal protective equipment to protect their family member. And I think this is how we'll need to be considering the conditions for quite some time now with, as we said, this additional tool of vaccination in our toolbox. And hopefully, as more and more people are vaccinated and we continue to deploy these good preventive measures, we'll see that rate of disease transmission go down. And when we start to see lower numbers, that's when the risk to our very frail and vulnerable elders will also decrease as well. So it's a combination of all of these different tools that will help determine that, not just one.
Thank you for that. The next question to Austin Montgomery, Beloit Daily News. Beloit Daily News. A reminder, *6 will mute and unmute your phone. All right, why don't we move on to Amanda Quintana, News 3 Now. Amanda, News 3.
Hi there. So my question is, has DHS finalized a plan about exactly where the vaccines are going? So for example, UW Health has said that they are a hub in Madison, and they say they've received about 4,000 vaccines, but they're not sure how many of those are for their employees, how many of those, you know, they're just storing and holding for other hospitals. And so they say that that's on DHS to decide where those go.
Yes, and we have communicated with each of our hubs of the allocation that they are receiving today, tomorrow, and Wednesday, what number of vaccine doses are for them to use within their own system, and what number of vaccines are to be available for our teams to distribute to the spokes. So we have communicated that to all of our hubs.
Thank you for that. Let's go now to Chuck Kornbach, WUWM Milwaukee. Chuck? All right, we'll try to get back to Chuck, and let's go to Evan Hong, News 18, Eau Claire. Evan.
Hello. All my questions have been answered already. Thanks.
All right, thank you. Let's move on to Mary Jo Ola, TMJ4 in Milwaukee. Mary Jo Ola.
Hi, good afternoon. Just curious, kind of going back on some things that I think Julie had mentioned, was that to clarify, the Pfizer vaccine has gone out to 2 of the hubs in Wisconsin so far. Can you just explain how many hubs are all together that are still waiting for that distribution? Thank you.
You bet. So we have 8 hubs right now that are receiving vaccine. That number could increase in the future. We do have additional places that have the freezer capacity, and so we will welcome additional hubs as we move forward. But for this first distribution, we had identified 8. So there are 6 more that will be receiving vaccine tomorrow and Wednesday. I also do just want to go back to, I think it was David Wahlberg's question about how many doses we've received today. While we've been on the call, I saw an email that came through that said nearly 10,000 doses have been received today in those first shipments.
Wonderful. Thank you for that. The next question to Maddie Heim, Post Crescent. Maddie Heim, Appleton Post Crescent.
Hi, thanks for having this call. I'm just wondering, as we look out into the next couple of months, as new vaccines get the emergency approval and we start to kind of see the results of the ones that are starting now, how frequently will you be revisiting the allocations of who's in the different phases, who are the priority populations, and kind of who's getting it next? How frequently will you be looking at that and determining if any changes need to be made? Thanks.
Yeah, that's a great question, Maddie. And so here's kind of how it's rolling, and I think this is how it will roll through the next few phases. As soon as we get one group done, it's time to start on the next group. And so our SDMAC and the Advisory Committee on Immunization Practice, ACIP, are both already starting to talk about phase 1B. Which they are both speaking of essential workers and how they will prioritize within essential workers. So it's like as soon as one phase is done, you start the decision making about the next phase. So that information is available to our teams who are working on logistics and allocation of vaccine. We'll need to again, titrate it based on what percentage of the phase 1A population is done before we begin also doing phase 1B. It'll also be influenced by how much vaccine we're receiving from the federal government. It will be influenced by how ready our vaccinators are to vaccinate more and more people. And so, it doesn't necessarily mean we have to finish all of phase 1A before we would begin phase 1B. But we want to make sure that we have made a good dent in it and that we have adequate vaccine to expand to a whole nother population of people. After essential workers, after they have that one recommended, they'll move into phase 1C that is likely to be people over age 65. That's a little bit easier to define. And also people with other diseases that put them at risk, a little bit harder to define because you'll have to figure out that list of people. And then it is our hope, based on how we're thinking through this, that after that phase, phase 1C, we'll be ready to move into more general distribution. So I hope that's helpful in thinking through it. Dr. Schauer, anything you'd add to that?
Yeah, just to reemphasize is that as we continue to roll through, that it will expand and ensure that there's catch up for those in earlier phases who may not have received vaccine. The door doesn't shut if you miss your phase and that's it. We will continue, but as you see, we finish and taper off with one, the other will be starting up.
Great point. Thank you for that.
Thank you both for that. And we'll go now to Natalie Sopola, WAOW in Wausau. Natalie.
Hi, all of my questions have been answered. Thank you.
Wonderful. Thank you. Let's move to Taj Mahal, WMTV in Madison. Tajma.
Hello, thanks for taking my question. So I know that the state has held mass vaccination drills in the past. At least the county health department in our area has participated. So can you talk a little bit about how these drills work and what has been learned from them that can help right now?
Great. I'm going to turn to Dr. Schauer for that question.
Yeah, and I think certainly when it comes to pandemic influenza, that mass vaccination is an important part of it. I will say we recognize that vaccination in these days, when it comes to in the era of COVID and needing to do social distancing and have more room, have really played into clinic planning and really have changed. I think there's there's more interest in drive-through clinics and things of that nature versus having people line up in the county gym. So I think we are certainly having to adapt and really relying on information from partners such as CDC about how to move forward with vaccination clinics in this new era to ensure that they continue to be done in a safe way, in an effective way. I think they're also learning that using new technologies or newer technologies that are touchless, paperless, are really being used much more often. And so that has been part of influenza pandemic planning, but is all the more important moving forward into this day.
Thank you. Next question to Catherine Larson, Spectrum News.
Hi there, good afternoon. My question is, how will the state be tracking and posting on the website how many people have been vaccinated?
Well, great. Dr. Schauer, you want to begin that one?
Sure, because you know that then I get to talk about the Wisconsin Immunization Registry.
Yes.
So as I mentioned, this is a key tool. It is a statewide tool that all immunizers will be reporting administered doses of COVID-19 vaccine in, and I will add are reporting other immunizations in. And so we will use the lessons learned and the ways that we do with other vaccines to go ahead and look at the data and provide regular updates both internally and externally as the campaign gets underway. And so we do anticipate sharing that information through briefings like this, as well as on our website, sharing that more data
Yeah, and I'll just add, as we've been thinking about how we'll share data and display data, we've been thinking very much around following many of the same categorizations and groupings of data that we have for other components of the COVID-19 pandemic. So if you think about how we describe cases or testing or other interventions, we'll be providing that same type of data. We also, it's important to remember in these beginning weeks, as we focus on a very targeted population, healthcare workers and long-term care, that the data is going to be a little skewed. It doesn't represent the whole population. For example, you won't see children in there because they're not part of our focused population. And the geographic location of where we're vaccinating people will be driven by where there are healthcare sites and long-term care facilities rather than where all the people are. And so we'll begin reporting data, but it won't start to reflect the full flavor of Wisconsin, as I might say, until we start to expand to broader and broader groups.
Thank you for that. Let's give the next question now to Nick Bohr, WISN in Milwaukee. Nick.
Good afternoon. As the vaccinations begin today, healthcare workers are on the front lines again, testing widespread use of the vaccine. What kind of monitoring is being done to see how they're reacting to it and the lessons that people can learn from that?
Yes, that's a very important component of any vaccine or medication that moves from a phase 3 trial into general use in the general population. And so it's really critical. So we'll be working very closely with people who are vaccinated to let them know how to report adverse events, any side effects that they have that are unusual, or, and we'll be working very closely with everyone who provides vaccine to understand those systems as well. And let me turn to Dr. Schauer to again describe those different systems for monitoring.
Sure. So we have the vaccine adverse events reporting system, which is in place, and that once again, that is where a provider or an individual can report any adverse event, and that is done to the CDC at the federal level. We have the new program called vSafe, which is something that individuals will go ahead and receive a text or can respond via the web on a daily basis in the period after vaccination and report any symptoms or issues that they are having. There's also a number of other programs such as the Vaccine Safety Data Link, which is a network of 9 integrated healthcare organizations across the US. We have one here in Wisconsin, and they conduct active surveillance and research, and the system's also used to help determine whether side effects identified using VAERS are actually related to vaccination. As well as there are a few other smaller programs, but really it's going to be done at a number of different levels to monitor for adverse events and report. The one thing I think it's important to remember is that as part of vaccination, sometimes folks will have some secondary reactions. They may have some redness or swelling at the site of injection. They may run a fever or have muscle aches. And that is part of the body's response to the vaccine. That shows that your body is actually responding and will be providing protection. But it is important that folks are aware that those could happen, and then that they talk with their healthcare provider and they talk with their employer about how to manage that. But that is an expected piece of being vaccinated. It shows it's working, but it is something that folks need to be aware of.
Good information, thank you. Now to Emily Davies, WSAW in Wausau.
I have so many questions, so thank you guys for taking this time. I will just do 2 if that's okay. One, I know that I think it was a week ago on your call, you mentioned again, essential workers is the next, phase B, 1B. Has there been any thought into teachers specifically, since they impact so many people by having children in their care, and we know that grades are not doing as well this year with schools. So is there any thought to putting those people in a higher priority than maybe others? And then secondly, with regards to distribution, again, these hub sites are where they're storing it, but who is actually distributing the vaccines? Is there a temporary workforce that's kind of working on this? Or is there contracts? I guess if you could explain those things. Thank you.
Absolutely. In terms of essential workers and who within the essential workforce will be prioritized above others, those discussions are underway in both of the groups that we've mentioned previously, ACIP and the SDMAC. And so I don't know that any specific discussion about specific groups such as teachers has come up yet. I do know they're thinking about a lot of broader criteria. So things like people who have exposure to the general public as part of their built-in work, people who have exposure to people who can't be immunized, which would include teachers and childcare workers, people whose jobs are so critical they can't be replaced, a variety of other criteria that they're looking at. And so I think it's much more likely we'll get recommendations along those lines than a listing of 1 to 1,000 of specific job categories. And your second question, was about the hubs and what we're calling the spokes and how the vaccine gets there. So our team at the state of Wisconsin, and this is bigger than DHS, we've been working very closely with Wisconsin Emergency Management and with the Wisconsin National Guard, are establishing teams to do that distribution from the hub site to other locations, as we call them, the spokes where vaccine will be given. Right now we have 4 distribution teams that include representatives of the Wisconsin National Guard. And as we move forward, it may include a combination of our soldiers and airmen in the Guard and civilians doing that work as we expand the teams that will be doing this. So that's who is doing the distribution. They're also working with other parties like the Wisconsin State Patrol and the Civil Air Patrol. And so it's a very robust partnership across state agencies to assure that this work is done. Again, this is high priority for us, is to get this vaccine out across the state. So we're leaving no stone unturned as to who can assist.
Wonderful, thank you. The next question to Eric Gunn, Wisconsin Examiner.
Thank you very much for taking the question. Outside of Wisconsin, there have been some reports of the delivery of vaccine to certain groups who are not in the priority of long-term care, healthcare workers, long-term care residents, and so on. I believe the example was cited as the White House staff, for instance. Are there any groups of people in Wisconsin who don't fall into the strict category of the priority 1A that have been granted an opportunity to get the vaccine early, ahead of when they would ordinarily? Thank you.
Not to my knowledge at this point in time, certainly not, not through any council of DHS or our team that is administering the program.
All right, thank you. Next question to Adam Rogan, the Journal Times. Adam Rogan.
Hi guys, thanks for taking this call. I know you said earlier that you can't reveal the specifics, which specific places are working as distribution hubs, but it's been just known and confirmed that the Pleasant Prairie facility for Pfizer is going to be a national distribution hub. So a kind of two-pronged question here. Can you just walk through what the role of the 8 distribution hubs in Wisconsin will be, and then if, like, how the Pleasant Prairie facility would work into the statewide or nationwide distribution as one of 2 national distribution centers for Pfizer?
Yeah, that's a good question, and I think a really good opportunity to clarify. So in terms of the Pleasant Prairie Pfizer facility, the state of Wisconsin is not involved with that facility in terms of our vaccine hub and spoke distribution. You know, it is CDC and Pfizer who are deciding where vaccine from that facility are distributed across the country. So it is not part of our planning and delivery. And I'm sorry, the second part of your question, Adam?
Sorry, it's can you just walk through the role, the 8 distribution hubs? What is their, obviously Pfizer is separate from that, like the other 8, how does they, like, is it, are they, I believe you said last week that they're kind of, they would send doses to vaccinators. That's still the plan, or how does that all work?
Right. So these are facilities that have the adequate freezer capacity to store at the -60 to -80 degrees centigrade required for the Pfizer vaccine. You know, they have freezers that can hold that temperature and freezers that have sufficient room to store the vaccine that comes on, that we anticipate will be coming on a weekly basis. So that's a big piece of how they were selected. They were also selected because they volunteered. They're not being compensated for providing this, this service to the public, and so that's another really important part. Then there is a combination of hubs. Some are smaller, some are larger. Some will distribute primarily within their own health system, that's the amount of space and size that they had in their freezer. Others have said, we are very willing to distribute across our area, and that's where we're putting the distribution teams across the state to be able to redistribute vaccines. So each week, the hub will receive an allocation. They'll know they're receiving this much vaccine. They'll know this, a second quantity of vaccine is what they can keep for vaccinating their own staff, and then they'll know a third quantity that will be redistributed to other facilities across the state. Anything you'd add in that, Dr. Schauer?
Yeah, I would just add that the hub and spoke model really is to handle the Pfizer vaccine, that should the Moderna vaccine or other vaccines that don't require this ultra cold storage or come in these large allocations come to fruition, that vaccine we would anticipate to go directly from the manufacturer to the end vaccinator. So sort of eliminating that step of the hub here in Wisconsin.
Thank you. And the last question to Sophie Carson, USA Today Network, Wisconsin. Sophie Carson.
Hi there. Thanks for taking my call. You know, General Perna from the Operation Warp Speed said today that 4 states are starting vaccines at nursing homes this week, and more will begin next week. So why isn't Wisconsin ready to start vaccinations at nursing homes now? You know, sort of why is there that 2-week delay that was mentioned earlier in the call?
So in order to vaccinate at nursing homes, you needed to know your allocation of vaccine and be ready to commit, as I said, a significant portion of that vaccine to nursing homes. And so in the early days, when some of those other states were making that decision, we did not know our allocation and did not know that it would be at a level continuing that we'd be able to support the program through the first month of the program. So we waited until we were clear about what our allocations would be from both Pfizer and Moderna. Another component of making the decision to move forward in that program is which of those vaccines you are going to use, because you need to use the same vaccine for the skilled nursing facilities as you do for the assisted living facilities. So we wanted to again have more visibility on the quantity of vaccine that we were receiving from each of these sources before we made that decision. Dr. Schauer, anything else you recall?
I would just add, you know, we also look towards the State Disaster Medical Advisory Committee recommendations as well, and in terms of timing. So the 2-week delay is just the time that it takes from the time that the state kicks off the program to when it's actually implemented. And so that is just a federal part of, or federal requirement for this program.
All right, thank you. And we have 2 reporters on our list who are not available when called on. So we'll try to go back to Austin Montgomery, Beloit Daily News. Austin Montgomery. Reminder, *6 mutes and unmutes your phone. Beloit Daily News. And Chuck Quirmbach, WUWM Milwaukee. Chuck Quirmbach.
Good afternoon. I was trying to ask before, Mayor Barrett said on a Greater Milwaukee Committee call today that he's trying to make sure federally qualified healthcare centers, including in the Black community, get adequate vaccine supplies, and he's been talking with the state. What is the state's response, please, to Mayor Barrett?
Absolutely. We will be assuring that all of our clinics, including our FQHCs, receive vaccine and are properly immunized in this process. Dr. Schauer, anything you would add?
No, I think that sums it up.
All right, wonderful. With those answers, it concludes today's briefing. We want to thank Deputy Secretary Julie Willems-Van Dijk and Dr. Schauer and all of you for participating. And we ask you to please continue to monitor the DHS COVID-19 web pages for data and for guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.